Hey everybody, welcome to Around Phelps Health, a series dedicated to having open conversations about healthcare topics relevant to our patients and community. I'm your host for today, Paul Hackbarth, and with me today is our guest, Dr. Nathan Ranchford, a gynecologist here at Phelps Health. Welcome to the show.
Thanks for having me.
Yeah, well, I guess I should say welcome back to the show. I know you've been on here a few times. So.
Yeah, these are always fun. Happy to do it.
Awesome. So, yeah, well, we're glad to have you with us. Today we're talking about reproductive health. That covers a broad range of topics. So I want to just jump right in, Dr. Ratchford. Let's start off talking about sexually transmitted infections, or STIs. These are also sometimes called sexually transmitted diseases, or STDs. So what are some common STIs? Let's start with that.
Yeah, so the most common ones that people are probably familiar with and would be tested for are going to be gonorrhea, chlamydia, trichomonas, herpes, hepatitis C, HIV. Those all vary in how common they are, but they're also things that for sexually active individuals, those are things that you would want to try to prevent and potentially be tested for.
Okay, gotcha. And then what are some signs that someone might have an STI, and do they differ for men and women?
Yeah, that's the interesting thing. So, especially in women, most sexually transmitted infections do not have any symptoms. So, I always counsel my patients caution if they potentially have a new partner and you can't tell by looking at somebody. Most people don't have symptoms. So it's important that if you could have been exposed to a sexually transmitted infection, that you get tested.
Okay, so I think I pulled some stats. It said that most common STIs can be found in like kind of youth, ages 15 to 24. But I think it's important to note you can get STI at any age, even the senior population.
That's absolutely true. I think we as a society, we kind of associate sexually transmitted infections with younger individuals, but honestly, they can affect people of any age, men and women.
Okay, so when it comes to testing for STIs, what does that involve? And then does Phelps Health offer testing for STIs?
We do. So most people are going to get tested for STIs either through their primary care physician or possibly their OBGYN. And then usually testing, it'll involve kind of what the situation is, but you should expect an exam, maybe some blood work, possibly a genital culture or a urine sample. Depending on what we're looking for, there's different ways that you test for these things.
Okay, and this is my plug here. If you don't already have a primary care provider, make sure you establish care with one. So switching gears, Dr. Ratchford, let's talk about Pap test. What are Pap tests, or Pap smears, I think they're called sometimes, and how often should women get them?
When someone comes in for a well-woman exam, really what you're talking about is a physical exam with your provider. And for women, that's going to involve not only a standard physical exam like listen to the heart and lungs, abdominal exam, things like that, but also it would be a breast exam and a pelvic exam. Typically when you talk about a Pap smear, what you're talking about is it's a screening test for cervical cancer. Usually what a Pap smear is involving is looking at the cervix with a speculum. Your cervix has skin cells on it, and you're scraping some of those cells off, and that's what they're actually looking at in the laboratory, is for abnormal cells of the cervix. Pap smears are screening for cervical cancer, which is a very common cancer, and that is caused by the HPV virus, which is passed with sexual intercourse as well.
Okay, so that can be that's an STI that can be transmitted.
For sure.
Gotcha.
For sure.
Okay, so as far as screening recommendations, what do you recommend? How often should women get a Pap test?
Yeah, it's been this way for a while, but there's still a little bit of confusion over this. But we used to do pelvic exams and Pap smears younger, but the current recommendation is that for all women, for standard screening, you start at age 21. What I usually tell my patients is that after age 21, they should do an exam every year. And then most women do their Pap smears about every 3 years if they're normal.
Okay, gotcha. So if a woman out there is maybe concerned or nervous about it, do you have any advice for them about maybe the first time they're getting a Pap test?
Yeah, so what I find is the most helpful is I appreciate it when patients admit that they're nervous about doing an exam. There's definitely things that I, as the physician, can do to make an exam easier for somebody. Pap smears should not be painful. They can be a little bit unpleasant for some people, but they shouldn't be painful. and they don't take that long to do. For most people, it's a pretty quick and simple visit.
Okay, so, and if they do feel uncomfortable, they can just talk to you or their care team.
Absolutely.
Okay, that sounds good. All right, so as we said, reproductive health it covers a wide range of topics. I think another common concern patients might see their doctor for is birth control or contraception. So let's talk a little bit about what is birth control and what are the different types of birth control.
Sure. So the most important goal that most people are seeking from birth control is preventing pregnancy until they want to be pregnant, which is understandable. Typically, if you look at the different options that someone can consider for birth control, I typically arrange things in order of how effective they are at preventing pregnancy. So for starters, you've got barrier methods. So this would be condoms, diaphragms, spermicides. Above that, you've got things like birth control pills, the vaginal ring, the patch that you can wear on your skin, Depo-Provera shots, which is a shot that you get every 3 months. And then there's also implantable devices like the Nexplanon that goes in the arm, and there's multiple different IUDs, which are devices that are placed inside the uterus. There's also permanent sterilization, which might involve either a vasectomy by a urologist on the male partner or the female partner getting what's called a tubal ligation, which is a type of surgery we do that basically interrupts the fallopian tubes.
Okay. Is that kind of when I hear some women call like getting my tubes tied? Is that what
Same thing.
Okay,
yep,
gotcha.
Same thing.
Okay, so, alrighty. So when if people are considering birth control, what are maybe some pros and cons, or what should they be considering when deciding if birth control is right for them? So.
Sure, there's a lot of factors to consider, and it'd be hard to simplify it down into just one pro and con with the different birth control. Really, it's a conversation you want to have with your provider on what your goals are, what you're trying to achieve. Keep in mind that any of these contraceptives also might have other benefits, such as condom usage can decrease not only pregnancy, but sexually transmitted infections.
Oh, okay.
I think most women are familiar with birth control pills. Not only prevent pregnancy, but they might give them better periods or help with their complexion, for example. So definitely, if you're interested in contraception, that's a good conversation to have with your doctor.
Okay, so sounds good. Dr. Ratchford, I think a lot of these issues we've been talking about, sometimes I think they also can relate to fertility or infertility. Can you briefly just kind of mention what are some options for, or what do you tell maybe women or couples who come to you if they're have questions about fertility?
Yeah, so human reproduction is not a very efficient process, and unfortunately, it's very common for couples to have trouble with fertility.
Okay.
Many times there's explanations for that, and so there's testing that we can offer for both the male and the female partner to evaluate is there a reason why they're having trouble with fertility. You know, we've talked a little bit about sexually transmitted infections. Mm-hmm. We've also talked about birth control options. Definitely exposure and lack of treatment of certain infections can lead to fertility. So that's a important reason to get this evaluated. And then also some of the birth control options can help protect your fertility until you're ready for pregnancy. So these are definitely considerations.
Okay, so that's good information to know. Awesome. Okay. So to wrap up here, I think I want to kind of just end on a good note here. When it comes to maintaining good reproductive health, what are some tips or recommendations you have for people?
Sure. So I frequently tell people if they take care of their bodies, it will take care of them. So, you know, the advice is straightforward, but keep up your regular preventative visits. For women, you should be getting pap smears when your doctor recommends that you get them. If you're overweight, you should try to maintain a healthy weight, a healthy diet, get plenty of sleep. That can help your immune system. If you're a smoker, quit smoking. If you have chronic health issues, make sure that those are maximized.
Okay.
Like I said, if you take care of your body, it'll take care of you.
Awesome. I love that quote. Yeah, so that sounds good. So it's interesting. So many of the stuff that you mentioned, it's good for our overall health, but it's also good for our reproductive health as well.
Absolutely.
So,
absolutely.
Awesome. Okay. Alrighty. Well, that's all for today. Again, thank you so much, Dr. Ratchford, for coming on our show, and you always share some great information.
Yeah, thanks for having me.
Yeah, so I know I learned a lot. I hope our viewers and listeners listeners did too. So, and remember, if you liked our show and want to know more information about the topics we cover here on this series, check out phelpshealth.org. And we'll see you next time on Around Phelps Health.